Hi there, it's Dr. E at Rockwood Natural Medicine Clinic, and I am thinking about something fun that I'm hopeful other people will find interesting as well. And my job every single day, my main goal is find the cause. And so I thought it would be really fun to go over some cases that I've seen in the last few weeks and kind of blown my mind. So hopefully you will learn something from them as well. So there was a young female, and she was struggling with urgent loose stool, obviously bothersome, right? Nobody wants to deal with 6 times a day of running to the bathroom and having some potentially embarrassing moments. And so she went on like this for a little bit, came in for an appointment. We tried some things that normally would work, addressing the cause. She didn't adjust. She responded a little bit, but not a ton. So I ended up doing a stool sample, and she didn't have any parasites, she didn't have any pathogenic bacteria, and there were some yeast, so I sent her some other items to try, and she came back a few months later, and this was just this past week, and she said, I went and ended up getting adjusted, which she was doing every 3 weeks anyway, and it hurt so bad, but it also felt so good, and I haven't had any loose stool since. So the point of that is not only, yay, that she's feeling better, but we or somebody else could have given every supplement in the book. She was already sticking to avoiding certain foods that we know she doesn't react well with. We had already done things to heal her gut, and what she needed was to get her spinal segments and her vertebrae back in alignment, because those were inhibiting and affecting her bowel movements from her intestines. So that was a fun one. Another one was a middle-aged woman who had urinary and fecal incontinence. And looking at this woman, she just exudes a picture of health. Obviously she had, not obviously, but to me I knew she had multiple issues, but from an outsider she just looked like she was vibrant and healthy, fit, but she was having urinary and fecal incontinence, which isn't fun for anybody, no matter what your age is. So for her, the cause was finding out her food intolerances. Once she avoided what she was intolerant of, both issues went away. So some other people, docs, self-prescribers may have done anything from hormones to pelvic floor exercises, you name it. There's a lot of different potential treatments, but for her, she was reacting to certain foods that were causing such issues as incontinence. So that was very exciting. Within a week, her symptoms went away. She hasn't had any in many months. So that's really cool because she was dealing with it anywhere from 3 to 6 times a week. Another one, last one I want to talk about today, a middle-aged female again. She was diagnosed with fibromyalgia, which, not to insult anybody that has either diagnosed somebody with that or has been diagnosed with that, but to me it's a bogus diagnosis. It's pretty much given to people when they don't know what to say they have for a diagnosis. So like I said, I don't mean for that to be offensive, that's just my experience. I've also found that people with fibromyalgia, there is nearly always a mental emotional component. And as you may know, I love focusing on mental emotional concerns with people and think we all have baggage to take care of, but especially people with fibromyalgia. So anyway, I was upfront and honest with her about this. She came in with 7 to 10 out of 10 body pain. Every day, she tried different things. Nothing had worked. She tried anti-inflammatories, supplements. She'd been prescribed medications that she didn't want to try. She'd done cleanses, you name it. She had tried things on her own. And she came in, and I was upfront and honest about the mental emotional component. At the end, I said, would you be willing, I don't even want to give you any supplements, would you be willing to work on a mental emotional concern that I think is affecting this and doing a neuroemotional technique or NET treatment? And she hesitantly said yes. And I kid you not, she sat up without pain. And it has been 6 weeks, 5 to 6 weeks now, 5 to 7 weeks. And she still has 0 pain. She had 7 to 10 out of 10 every single day in muscles, joints, bones, you name it. Her energy was lagging. She was really struggling. 0, 0, 0. So confession, I got a little teary with her when she sat up and said the pain has been gone ever since. So that is just something, a little tidbit to take with you today. If you are struggling, there is a cause. There is a cause that's lingering. Perhaps you haven't found it yet or worked with somebody who's been able to help you find it, but there is a cause. So please work with somebody who can help find the cause, such as a naturopathic physician like myself. But yeah, please have hope and keep digging and finding the cause, and have a great one. Comment below if there's any questions or concerns, or if you're curious about certain cases or topics, and I can discuss those in the future. Bye-bye.